the concept, in the technique Smile-in-3-Days, we are using single piece implants, and there are numerous advantages of using a single piece implant. Single piece implants have been actually designed for immediate loading and immediate placement for a missing tooth or missing teeth. So let us first uh, get a quick understanding of the structure of a single piece implant. So a single piece implant is basically made up of a complete one piece monoblock, and there are no connecting pieces in it. So it's just a single rod where the upper part is designed to hold the crown or the bridge and a thin long neck and rough surface to engage the bone. Whereas if you compare this with a typical conventional implant, the conventional implant is made up of an implant body which is inside the bone, and this part is first placed in the bone and covered with the gum so as to allow it to osseointegrate for 3 months. Then after 3 months, the gum is again an injection is given, the gum is cut open, and this abutment is placed, and on this abutment there's a screw which holds the abutment with the implant body. So this implant body is like a hollow tube, and this again is like a hollow tube. So they telescope inside each other and they are held together by a screw. So when we are always saying single piece implant, what we mean to say is that a single piece implant has a solid neck and it is bendable. Whereas in a multi-piece implant, we have to change the abutment for different angles, but those angles are limited. They can be 0 degrees, that is a straight abutment, or a 15 degree or 25 degree. But there are no in between angles. Whereas this can be more refined till we get proper parallelism, we can keep bending. And there are, of course, limitations to it, but it is highly customizable, the angle for bending. And the important part is that this part of the neck is very thin. This is the area which usually gets infected. This is the area which gets infected whenever there is a recession of the gum. Because once a tooth is pulled out and implant is placed, no implantologist will guarantee that the bone will not shrink. No one will say that. The bone can shrink, and along with it, the gum can descend down, exposing the implant. So when the implant is exposed, this part of the implant which is exposed is very bad compared to this implant part, because this is highly polished, gold anodized, very resistant to peri-implantitis, and it is very thin, the cross section, compared to the cross section of a conventional implant. So the reason for using single piece implant is that it allows us to use an implant which is resistant to peri-implantitis, and if you use it immediately after extraction, if you put this implant, this is a very safe implant compared to this side, this one. And again, this kind of implant can be used for cementing the bridge, whereas this implant, we can use it for cementing also, and also for anchoring with again another screw, something like this, wherein they use a implant body and then again a connecting part, then again a screw, then a sleeve, then a screw. So this is made up of 5 parts. So a conventional implant can be made up of 5 parts to 3 parts. And the most common problem of these implants is the loosening of the screw. And once the screw becomes loose, you have to keep going to the dentist and they keep tightening it. And with time, repeated tightening, causes a problem. So the conventional implants can be made up of 3 to 5 parts, and these parts can keep becoming loose, and this has to be repeatedly tightened periodically. The patient has to keep going to the dentist to keep tightening it. A very nice analogy to this is like you may be having a frying pan at home, and the handle is attached to the pan with a screw, and you keep tightening it, and every few months it keeps becoming loose, and whatever torque you may give, it again becomes loose. Maybe this is not the right example, but this is what I think every household has. Then, so this is a big issue. And what happens whenever this screw becomes loose and the patient may not be able to address it immediately? They may be traveling, or they don't have enough time, or they may not be getting proper appointment. So the patient keeps chewing, and parts the other parts will get that stress, and sometimes the screw breaks in the other area. We keep getting a lot of cases like that, wherein the connecting screw becomes loose and the other side it has broken. Now, coming to, so this is what you see here. So this is what you see here, all the interconnecting parts, and you see such interconnecting parts in the X-ray also. And whenever the implant is tilted, the stresses are much higher, and these screws are very small, and they become loose, and they keep breaking. So in conventional technique, when they fix the bridge with screws, they have those vents for the screw, and the screws are tightened, and then they are sealed with the cement. This is so that whenever the patient has problem again, they will remove the cement and open the bridge, remove the bridge out by loosening the screws. But this is a problem because every few months the screw keeps becoming loose, and they have to keep going for the tightening part. And one more important thing is that these vents weaken the structure around, and for example, here you see it's a denture, it's an acrylic denture. So the remaining part is weak and will wear out or fracture. Whenever these implants, the conventional implants, are tilted, they may break like this because the well of the implant body is very thin. So what happens is that because of unequal forces on the implant, they may crack and will eventually fail. One more issue with multi-piece implants is because of the interconnecting parts, there is always some micro leakage, because at the micro level, there is always uh, a fine gap at a micro level. And because when the patient is chewing, it's more like a pumping action, and the food can seep into the food in the saliva. It can seep into these micro gaps. So always these micro gaps are filled with food, nutrients, and bacteria. So there is always inflammatory response at this level. So you will always see that there is some bone loss at this junction. When we use single piece implant, all these issues are not there. It is a single rod, and there is no micro leakage. There is no weak components at all, and there is no breaking of the connecting screw because it's just a single mono block, and there are no such ungainly, ugly screw vents for tightening, and the teeth are beautifully made from zirconia, and they are good for chewing food. They are non-chipping and strong, and you will, in our x-rays you will see that they are single piece.